Well, good afternoon, everybody. I know there's considerable public interest about the New Zealanders on the Diamond Princess in Japan. I've been informed by the Ministry of Foreign Affairs and Trade that the New Zealand passengers have been offered and strongly encouraged to take the flight being provided by the Australian government. Final numbers will be confirmed by MFAT this evening. MFAT have also told us that they are currently planning on a return for those passengers to New Zealand as quickly as possible after they are in Australia. The two New Zealand passengers currently in hospital in Japan are both recovering well, but they will not be returning on this flight. Another family member who is well is staying with the two in hospital. Alternative arrangements will be made for their return when it's appropriate for them to do so. Any of the Diamond Princess New Zealand passengers that do not return with the plane provided by the Australian government will find it difficult to do so for at least the next 2 weeks. We have advised all passengers that it is unlikely that they will be able to travel by commercial flight for 2 weeks after leaving the ship. All of these precautions are being taken due to the high-risk environment these people are coming from. We appreciate the impact on individuals and their families from this isolation, and we thank them for their cooperation. The intention of these precautions is to protect them, their family, and the wider community. A separate cruise ship that docked in Cambodia has at least one confirmed case of COVID-19 after most passengers from the ship had dispersed. We know from MFAT that there were 16 New Zealanders on board, and we are watching the situation very closely. Before I hand over to the Director General of Health, I should just note that tomorrow, Wednesday, the 157 New Zealanders, Pacific Islanders, and other citizens who were isolated in Whangaparoa after being flown out of Wuhan will end their 14-day period of isolation, and if still well, will be able to go home. We've been very pleased with the way the Whangaparoa facility has worked in terms of the isolation for these people. I want to thank all of the medical staff and others that have worked in support of those who have been in isolation there, as well as the wider Whangaparoa community. Hand over to the Director General of Health. Ashley.
Thank you, Minister. Kia ora koutou, and welcome again to the Ministry of Health. So I just want to quickly refresh the border restrictions. You'll know that these are under review every 48 hours, and the latest review is underway at the moment. We're continuing to review any emerging evidence, and those current border restrictions are only in place at the moment for travellers from mainland China who are not New Zealand citizens or permanent residents. In terms of self-isolation, we have at last count 4,561 people as at midnight last night who were self-registered or who were registered, all being contacted by Healthline. And those who haven't self-registered, we have the information now for the vast majority of those people, and Healthline is making at least 3 attempts to call all those people. There has been some discussion in the media around the availability of PPE for folks working in primary care, so GPs and people working in general practices. Some practices, I understand, have been experiencing difficulties in accessing supplies of PPE. So we're working with the PHOs around the country, and we sent a request last Friday for them to update us on the stocks of PPE that they have, and we will have the responses from that. I'm also on a webinar this evening with primary care general practitioners. We held one of these 2 weeks ago and had over 300 GPs on the line. We'll do another one tonight just to let them know what we are doing and also to hear what their concerns are directly. I should say that the Ministry has significant national reserve supplies of PPE to support a pandemic response. For example, we have in stock almost 9 million of the P2 face masks. These are not the routine surgical face masks. They are the ones that are effectively a respirator mask designed to remove fine particles when they're sealed around the mouth and nose. So that stockpile is there, it is ring-fenced, and it is released in the case of a pandemic. And it is not just available to hospital staff, it is available to all those either in primary care or first responders who may need to have that PPE. So that's something we're keeping a close eye on, and I can update you further tomorrow on any further issues that primary care has identified. I'm happy to finish there, and we can respond to any questions you may have.
Questions?
Can you just really spell out why those people coming from New Zealand off the Diamond Princess need to go into a further 14-day isolation?
Yeah, those people coming back from the cruise ship have been in a situation where the infection rate is far higher than it is in China. We are concerned for their well-being, but also for their family and for the community. And so we want to take a precautionary approach, as we have all along with this outbreak. We're yet to have a confirmed case of COVID-19 in New Zealand. And part of the reason for that is because we are taking such a careful approach and putting public health and safety as our number one concern, making sure that all of our decisions are informed by science, by clinical experts, by doctors. And the advice that I've received is that we need to make sure we're taking a cautious approach here too.
And those 157 that are leaving tomorrow, what's being done between them leaving and then the others coming in? Is it going to be a full-scale clean, or like what's going to happen?
I'll actually let the Director General of Health address that, because that goes to a public health response in detail. Sorry.
So there's been very rigorous cleaning on a daily basis at the base there in Whangaparaoa. It's a much smaller group, so we'll be downscaling from 157 to probably somewhere around 10 people, and we'll be doing a very rigorous clean. Of course, you'll also recall that most of the people there at the moment, if not all, are actually in camper vans, so they'll be cleaned as would normally be after someone had used them. So normal cleaning protocols.
Can you give a few more details about what the plans or procedures will be for that group leaving tomorrow? Will they have support outside of that facility? Will they be going home? Just a few more details.
So the group who are coming back from the cruise ship, the Diamond Princess, will be, oh sorry, you're meaning the group who are exiting. Actually, no, they're free to go home. There are certainly obviously arrangements being put in place to ensure they've got transport. For those who are foreign nationals, all the arrangements have been put in place with Foreign Affairs and Trade to ensure that they've got transport out of the country back to their home countries, working closely with the relevant consulates here in New Zealand. So that's all well and trained.
What will happen to any passengers who avoid quarantine? Will they be allowed to re-enter New Zealand?
Look, we've been really clear, particularly in respect of those on the cruise ship, that they will find it very difficult to get back into New Zealand for at least the next 2 weeks if they don't go on the commercial flight that is being arranged to bring them safely back to stay at Whangaparaoa. That's important. We want to make sure that we're putting the health and safety of New Zealanders, of our public, as our number one concern. And for those people, there is a very clear path back to New Zealand. And it involves making sure that they are protecting themselves, their family, and the wider community.
Why didn't you get passengers off and start their quarantine 2 weeks ago? Or at least give them a warning that they have to repeat their quarantine?
Well, look, this has been a rapidly evolving situation, and there is, of course, complex conversations going on between different governments about arrangements, and also, those people who were providing the quarantine on the ship were responding to what was a rapidly evolving situation. So I think only over time did it become apparent quite how widespread the issue was on the boat. So I'm not about to cast any aspersions on those people in their attempt to provide a sufficient quarantine there. We know where the situation is at now, and we want to do our best by those New Zealand citizens.
So there was some suggestion earlier today at the Chinese embassy from the ambassador there that the relationship between China and New Zealand may be strained if the travel restrictions weren't lifted or if they were extended. Do you have anything to say about that?
We've been very careful in all of our decision making to put the public health of New Zealanders as our number one priority. That said, none of these decisions have been taken lightly. We've been very careful to make sure that we have in place a 48-hour review We don't want these restrictions in place any longer than they need to be. We're seeing globally that this is having quite an economic impact, this disease. And of course, we're mindful of New Zealand's economic interests, but first and foremost, we're looking out for the health and safety of New Zealanders.
And how would you characterise the relationship as it stands at the moment between New Zealand and China?
Look, I think the relationship is good. We're making sure that we are in touch with them regularly. And of course, we're moving in step with many other countries here, but we are an independent country, so we're reviewing the scientific evidence. And if we see the opportunity to lift restrictions because we think there's a reduced risk or any other reason that we might lift those restrictions, then we would do that. But first and foremost, the health of New Zealanders is our priority.
What do you say to criticism for the opposition that we're not providing enough support for people like self living with flatmates? Some people are sleeping in their cars.
Yeah, so we've seen one anecdote of one situation, and the opposition has tried to build a story around that. So I just push back gently, but what I would say is that unlike other countries, as far as I'm aware, New Zealand's unique in setting up the specific health line and actually reaching out and contacting all those people in self-isolation. They are there to help. We're wanting to make sure that people who are self-isolating are supported. If they have any concerns, even if it's about getting groceries or arrangements that are in place, we want to make sure that New Zealanders, permanent residents, those people who are returning are supported. And as I say, we're going above and beyond where most other countries are that we're aware of. But we make no apology for that. We want our citizens to have that experience as positive as it can be, whilst preserving the health and safety of the wider community.
Is it putting their flatmates at risk?
Look, there's clear public health guidelines on the Ministry of Health's website about how to make sure that people are not putting others at risk. Self-isolation doesn't mean locking yourself up in a room and not seeing the outside world. It's quite legitimate for people to go for a walk around the block. It's quite legitimate for people to get out. What people are discouraged from doing is congregating. Don't invite over a big group of friends for dinner. Don't go to crowded public places, and so on. So it's about a sensible public health response, being aware of the information, and the Healthline can provide that information in great detail to anybody who has any concerns. They can call the dedicated Healthline.
What time and when will the flight likely to touch down in New Zealand?
Look, I don't think that is finally confirmed. Director General may have a more up-to-date timeline. I think that final detail is being sorted out, whether it's, Director General, do you want to speak to that?
So the latest information I have is that the flight is unlikely to leave Japan until late tomorrow evening, New Zealand time. And what we're doing at our end now is standing up the response to make sure we can retrieve the New Zealanders from Darwin, get them here, process them through Auckland, as we did with the evacuees out of Wuhan, and then look after them at the Whangaparoa facility once they're here.
Do you have concerns that those on board the flight will get infected by people unknowingly infected with the disease? What's being done to prevent that?
So we'll have similar precautions in place. And again, we're working closely with the Australians, as we did with the Air New Zealand flight that brought folk out of Wuhan. So basic hygiene precautions can really limit the likelihood or the risk of transmission. You'll recall, I think, that the American group that flew out, they found out that a number of them were tested positive for coronavirus once they were on the plane, and they just took very sensible precautions, isolated them, and put in place usual infectious disease precautions for the duration of that flight.
So there might be a bit of different level of segregation and in-flight modifications.
My understanding is anyone who tests positive won't be getting on the flight in the first place. And just as the Japanese authorities have done with people who test positive who have been on the ship, they'll be looked after in hospital until they're well.
Would you say the flight is quite high risk?
No, because of the precautions that will be in place. And the Australians and ourselves have now got quite good experience in undertaking these sorts of flights for people who may be coming from a high-risk situation. Again, remembering that if they have tested positive or they're symptomatic, they won't be boarding the flight in the first place.
And if they tested negative, someone said that they could still be ruined the virus. What does that mean?
Yes, I think that someone was me. So someone could be very early in the infection and not expressing the virus in their throat when the swab is taken. We don't know that for certain, but it's possible. So therefore, the 14-day period, which we know is a little longer than the maximum incubation period will be sufficient if people remain asymptomatic for that period. We've got a that's very reassuring that they won't be harbouring the infection and won't go on to develop coronavirus.
How realistic is it that we'll actually be able to stop the virus from spreading here? Some public health experts say we're just delaying the onset until winter, in which case the effect might actually be worse.
So what we are working to is a very well-developed, tried and tested pandemic plan. We're currently in the first two phases, which are keep it out and or stomp it out is the language we use if we do get a case. In other words, if we have a case, we contact trace people, we isolate them, and we're able to contain it. Those two phases are the phases we are going to stay in for as long as possible, of course, while we watch and see what's happening globally with this condition, because it may well be the epidemiology is such that it starts to die away. That would be ideal. So I think we're in a good position if we can keep cases out for as long as possible, and that's what's driving our current measures.
Is there any consideration being given to perhaps extending the travel restrictions to other countries that are bordering mainland China, such as Vietnam, Cambodia, where other cases are seen?
Not at this stage, but if we were to do that, it would be based on the epidemiology, and we would provide advice to ministers who are the decision makers on that, but not at this point.
Do we have any idea when those two infected New Zealanders will be coming home?
No.
And will they be put into isolation when they return?
No, because they will be well, and if they're not symptomatic, then they won't be at risk of transmitting the virus to someone else.
Thanks, everybody.
Thank you very much.